Hi, good morning, Rick. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 26th of September 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Rick Martin.
And what is your candidate number, please?
My candidate number is 230450670.
And you are taking this test as a nurse. Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Can you describe a challenging situation you've encountered in your nursing career, and how you handled it?
In my previous role, we had an unexpected surge of patients due to a sudden flu outbreak. The staff was stretched thin, and patient care was being compromised. I immediately collaborated with fellow nurses to prioritize tasks, ensuring critical patients received timely care. Additionally, I communicated the situation to the charge nurse, who then mobilized additional resources, helping us manage the situation effectively and provide the necessary care to all patients.
How do you handle difficult or uncooperative patients and their families?
Patience and effective communication are key when dealing with challenging situations. I always strive to maintain a calm and empathetic demeanor, actively listening to their concerns and addressing them respectfully. Sharing information in a clear and understandable manner, and involving them in the care plan, helps build trust in these tensions.
Describe a time when you had to adapt to a significant change in a work environment. How did you handle it?
In my previous workplace, there was a major shift in our electronic health record system. To adapt, I actively participated in training sessions, sought guidance from experienced colleagues, and dedicated extra time to familiarize myself with the new system. Embracing change positively and staying proactive ensured a smooth transition, and I quickly became proficient in utilizing the updated technology.
How do you prioritize your tasks and manage your time effectively in a fast-paced healthcare environment?
Prioritization is crucial in a fast-paced setting. I start by assessing the urgency and importance of each task, addressing critical and time-sensitive issues first. Effective delegation and collaboration with the healthcare team also help manage workload efficiently. I stay organized and use tools like to-do lists and calendars to ensure I meet deadlines and deliver optimal patient care.
What steps do you take to stay updated with the latest developments in nursing and healthcare?
Nursing is an evolving field, and continuous learning is essential. I regularly engage in professional development activities, attend seminars, workshops, and conferences to stay updated with the latest research, best practices, and advancements in healthcare. Additionally, I'm an active member of nursing organizations and follow a reputable medical journal and online platforms to keep abreast of new developments in the field. This helps me provide the best care based on evidence-based practices.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good afternoon. My name is Rick Martin. I'm a nurse at the Community Health Center. What brings you here today?
Hi, good afternoon, Nurse Rick. I'm the parent of a 6-year-old girl who is having frequent heavy nosebleeds at night. I would like to know what's causing them and to get some advice on managing them.
I see. That must be very worrying for you and your daughter. Well, may I know your name, please?
My name is Mihiraa.
Mihiraa, how often has she been having these nosebleeds?
Well, they have happened 3 or 4 times this week and lasted a few minutes. Sometimes there's only a little blood, other times there's quite a lot, about 1/3 of a cup.
I understand. Has she had any other symptoms?
No, she showed no other symptoms.
That means nothing like fatigue, bruising, or fever?
No, nothing like that. She seems fine otherwise.
Okay, considering your daughter's frequent nosebleeds, we need to explore potential causes. Mihiraa, it's important to understand that children, in their active play and exploration, might sustain minor injuries to the nose, triggering nosebleeds due to the nose's sensitivity. Additionally, infections like colds or sinus issues can cause nasal irritation and dryness, making the nasal lining more prone to bleeding. Another aspect to consider is the possibility of scratching or picking the nose, often unintentional in children, which can irritate the nasal membranes and trigger nosebleeds. Furthermore, certain medications, especially those with drying effects, could contribute to nosebleeds, underscoring the importance of reviewing any medications your daughter might be taking. Lastly, exposure to dry air from air conditioning or heating systems can dry out the nasal passages, making the nasal lining more fragile and likely to bleed, especially with prolonged exposure. Examining these factors can help us pinpoint the likely cause of your daughter's nosebleeds and guide us in managing and preventing them effectively.
Sure, I will. Nurse, she hasn't been scratching her nose. She hasn't hurt herself or had a cold and isn't taking any medication either. However, we've been using air conditioning at home recently, so it might be that.
That could be a possible cause. Mihiraa, understanding the potential cause of your daughter's nosebleeds is a crucial step toward effective management. The observation regarding dry air is indeed pertinent. In environments where the air is dry, such as in air-conditioned or heated spaces, the nasal membrane can dry out, becoming crusty and susceptible to cracking. These circumstances significantly elevate the risk of nosebleeds, particularly if there's any rubbing or irritation.
Oh, I see.
Mihiraa, in the event of a nosebleed, adopting the right management techniques is key. Ensuring your daughter is in an upright position, leaning slightly forward, helps prevent the blood from flowing into the throat, which can cause discomfort or coughing. Additionally, applying gentle pressure by pinching the nostrils, just below the bridge of the nose, for approximately 10 minutes aids in clot formation, ultimately stopping the bleeding. During this time, it's crucial to avoid blowing the nose, as it can disrupt the clotting process. Mihiraa, maintaining an upright posture and refraining from leaning back or lying down further assists in minimizing blood flow and discomfort during a nosebleed.
All right, I will take care of it. By the way, nurse, what can we do to prevent the nosebleeds from happening?
Mihiraa, it's crucial to understand that completely preventing nosebleeds may not be entirely feasible. However, we can certainly take measures to significantly reduce their occurrence and frequency. You can try to reduce their occurrence and severity by moisturizing the lining of the nose with some petroleum jelly or saline nasal spray. You can also use a humidifier or a bowl of water in your daughter's room to add some moisture to the air. These steps work towards creating a more comfortable nasal environment for your daughter, minimizing the likelihood of nosebleeds.
All right, thank you for that advice. I'll try that. Is there anything else I should know?
Well, Mihiraa, you should know that nosebleeds are not usually a sign of anything serious, and they are pretty common in children. If, despite these efforts, the issue persists, or worsens for more than 2 weeks, please reach out to us. Remember, you're not alone in this journey, and we're here to guide you every step of the way.
Okay, thank you very much for your help. You've been very informative and reassuring.
You're very welcome. I hope your daughter feels better soon. Take care.
Thank you, nurse. That is the end of your OET speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.